Welcome, and thank you for downloading the video on tips to help with neck pain and stiffness. I'm Chris Erickson, a physical therapist and owner of Executive Health Solutions, and you have made the right choice. You clearly value and think it's important that your health and wellness and this neck pain or these problems are bothering you, and you need something to help reduce that pain, reduce that stiffness, improve your motion so that you can be more productive, so that you're not being held back or missing out on the things that you find important and the things you need to do during the day. So the first thing we need to talk about is why neck pain can happen. I'll preface this by saying, of course, the tips that I'm going to show you today by no means are universal or fix everyone, but they will help the vast majority of people. Based on my experience, I've seen hundreds and hundreds of necks in the past, and these tips will help quite a few people just by doing very simple things. What we need to do first, though, is get some baselines. You need to figure out kind of where the pain is, what makes it better and worse. I should go back for a second. Most people will have pain that's called mechanical pain. Mechanical meaning there's something in the bone, the joint, the tissue, muscle, disc, something that's causing the pain. Similar to if I hold my finger back here for long enough, that starts to hurt because I'm mechanically stretching and I'm putting those tissues on stretch, and eventually it tells my brain, ooh, you gotta let go, that hurts. That's very similar to what happens in the neck at times based on sustained or prolonged postures, positions, movements. At times it can happen from a one-time accident, a fall, lifting something heavy, but that's not as common. Most of the time these things happen over time, and you start noticing some stiffness in the way you move. You may even notice it when you're driving home, say in the morning. Feel pretty good, not too bad. After hours of sitting or doing things, now I'm trying to move, trying to turn. I can't turn as far as I used to, or some days you turn freely and some days you don't. That's absolutely mechanical pain, and these tips should help you with that quite a bit. So get those baselines right off the bat, and the baselines that are the most important for us today are the pain intensity and location. Where is it? And then your mechanics, how you move. So knowing that the pain should be either in the middle of the neck or very commonly just off to one side, either to my right or my left. It can even be in through the trap, or maybe even in the shoulder blade or shoulder. A lot of people say, oh, my shoulder hurts, when it's actually a neck problem. You start moving the neck around, the pain goes away. It's a good thing. It's amazing to see people's faces when they like, oh, pain's gone. What happened? I'll explain that to you again in probably in another video. So in this one, though, what we need to do is take those baselines. Where's the pain at? Okay, for me, let's say it's on the left side here. It's just here and kind of into my shoulder, right up in there. About a 4 out of 10. And then I'm going to take baselines. Okay, I can turn to the right. Okay. Ooh, it's kind of sticky to the left. Can't quite turn because it hurts. I go up, look up. That's a little hard to do. I look down. Not too bad. So now we've got baselines. We know what. We have something we can compare to after doing these movements, and then you'll know if you're getting better or worse. So the first one will be what's called a chin retraction. It's the opposite of how we spend most of our time. Now, the reason that, like I said, going back again from we talked about before, having the head and neck in these sustained postures forward from either being on a computer, reading, writing, maybe on a phone. So you're usually either protruded or flexed for many hours of the day. So we want to use the opposite movement to move those bones in the opposite direction. When you're in this position here or here, you get lower cervical or the lower bones into flexion, okay, sustained flexion. And if you're forward this way, the upper bones are in extension. If you're flexed, then the upper bones are also in flexion. So we're going to do the opposite by moving the chin, the head and neck backwards to make those lower bones go back into extension a little bit. The most common way to fix this problem. So the easy one to do is to sit nice and tall. You can't get in the right position. This movement is not effective if you're slouched. You have to get your hips and your butt all the way to the back of the chair. Sit tall. You've taken your baseline, so you know what that feels like. Now you're going to work into what's called a retraction. Straight back, the head and neck and face go straight back. It's not this, it's not that. It's the whole thing straight back. 1, 2. Now you may feel some increased pain with this. It's very possible. Think about how long most people are in this position. These muscles adaptively shorten over time because we're in this position. Now when you go here, you can see how they're lengthened, and I'm putting tension on those muscles. So you can feel a little bit of a stretchy or a strain type pain, possibly even a little bit of pain to that side you're having the pain on. But then when you stop and come out of it, more than likely, it's going to calm right back down to where it was. Don't be frightened by that. Keep going. Keep going. Unless, the caveat to this is, unless the pain starts to actually move further down the arm or away from the spine, then that is wrong. Stop these. Let me know. Let another health professional know, and we can work on that. But as long as you feel a little bit and maybe increased, and then as soon as you stop, no, it's no worse. Keep trying. I want you to do a set of 10 of those, 10 full ones. Go slow. Pressure on, 1, 2, 3. Pressure off, 1. Pressure on, 1, 2, 3. Pressure off, 2. 10 times. Then you're going to come back and you're going to recheck your baselines. So the pain baselines will be, where is the pain located and how intense is it? If it feels the same or a little better, keep going. Even if it's slightly more irritated, but it's more irritated more towards the middle of the spine, towards the actual bones, that's okay too. Keep trying. Like I said, it just can't go away and down and stay away. That's wrong. Then check your mechanical baselines and see, do I feel like I turn any farther than before? Even if the pain's the same, but your mechanics, your ability to turn left and right or look up and down feel looser, then perfect. Keep going. More. Set about 3 to 4 sets of 10 of those. Number 2 will be, now that we've got that one working the right way, let's stretch out some of the side muscles here that can get tight from often being this way. Now, it's definitely common for us, for the guys as well, but definitely for the ladies that I see, tend to be a little tense and tight up here with doing things. So we got to get, again, in that good posture to start with. We can't do our movements or our exercises from a bad position, from a bad posture. It's got to be start in the right base, the right posture. Let one arm hang down, the other arm come up. You're going to be slightly tucked in, and you're going to just come over to the side. You're not pulling, just the weight of the arm and hand, just lightly. You'll feel that stretch along here. We're going to hold that for 15 to 20 seconds. And then we're going to try to get the angle here, right? So we're going here slightly, not here, a little bit here, and then over to the left, about 6, 7 times on each side for 15 to 20 seconds, okay? That will help with this one here. Again, afterwards, check your baselines. Where's my pain at? How do I feel? What changed? Can I turn further than before? If so, you're on the right track. If it's the same, you're not any worse, don't worry, keep trying. You probably just need more volume, more repetitions. Okay, if those things have been met and you're feeling like it's the same or feeling a little better and you're moving a little further, the pain's getting a little less, you're feeling it's less stiff, then we're going to go on to number 3, which will be to use the weight of your head and gravity to put a little bit more pressure on the lower cervical spine. And the lower cervical spine, well, first of all, we have 7 vertebral bodies and joints in the neck, and those lower couple, 5, 6, 7, are where the vast majority of problems happen. So we're going to take advantage of the weight of your head and gravity by putting some pressure and some more load on those joints, okay? So now what we're going to do is you have to still get in the right position. Always got to start from the right posture. Then you're going to tuck in that first thing that we did. Very important. You got to be here first. Then let the head roll back from there as far as you can, and then come back up. Now that one might give you a little bit of a pinch, a little bit of a pinch back there because you're putting so much pressure on there. But as long as when you come back up and you give it 5-10 seconds, nope, no worse, calm back down, a little bit of increased pain, but then when I stop, no worse, keep trying, keep going, you're gonna be okay. We're gonna do 10, so we'll do 10 that way where we tuck and go back and come back up. And that after that 10, again, baselines need to be reassessed, rechecked with turning and where the pain is. With those tips, the movements, the posture, the education that you just had, that should be enough to knock out or significantly reduce the vast majority of neck pains and stiffnesses that you get from sitting in an office chair, sitting on a plane, hobbies, crafts, things where your head is down. Please use those. Take any information that you've gained or can benefit from that. And I hope everything is going very well for you. If you have any other questions or you need anything else, or some more information, or have questions, or would like to see a different video or a specific problem that you have, let me know, and I can help you with that. Again, my name is Chris Erickson with Executive Health Solutions. I hope you have a great day and that you feel better very quickly and stay productive and just keep working, keep doing what you love to do. Thank you.